Welcome to my presentation on hepatitis A. Hepatitis A is a non-enveloped positive strand RNA virus whose only natural host is humans. So this virus affects humans. It is a common viral infection worldwide that is transmitted via the fecal-oral route. So if you ingest fecal matter that has hepatitis A, then you will also get it. The species name is hepatitis A virus, or HAV for short. So hepatitis means inflammation of the liver, and there's different kinds of hepatitis such as B and C, and also alcohol can cause hepatitis. So the virus is absorbed in the stomach and intestines, and then it travels to the liver via the portal circulation. So this is the liver infection. The highest level of the virus is in the stool. This disease can also be transmitted via blood. So if you're hepatitis A positive, then it will be in your blood and your stool, which can be transmitted to other people. So you can get this disease by close interpersonal or sexual contact with an infected person, or consumption of contaminated food or water. So if a person making your food doesn't wash their hands after going to the bathroom and they touch the toilet handle, which has hepatitis A on it, then more than likely they will be spreading that to you. Epidemics are common in regions where sanitation is poor, especially for hepatitis A, because it is very disinfectant resistant. So some more characteristics of hepatitis A. It survives in the acidic stomach environment, and then it moves on to the liver, where it replicates in hepatocytes, which are liver cells. So non-enveloped hepatitis A is very stable and is shed in feces, while it is preserving its ability of a pathogen to establish an infection. So this is not a chronic disease, and it will not cause chronic liver disease. So a chronic disease is a disease that is pretty much with you for life. It is a long-lasting disease and usually need ongoing medical assistance. So if you get hepatitis A, it won't be with you for life, and you won't have liver disease for the rest of your life. It will pass. So hepatitis A is highly transmissible to other hosts or humans because of its cyclochemical stability, which means it's able to resist chemicals really well. So it's stable in many environments and is able to survive on surfaces for weeks, which is important to wipe down your surfaces with disinfectants, especially during an epidemic. So in order to kill off the hepatitis A for food, you need to heat it for 1 minute at 85 degrees Celsius or higher. And if you're disinfecting the surface, then you can use household bleach for 1 minute. And also, hepatitis A can be spread via blood, so always use a clean, sterilized, and new needles that come out of the packaging. So if symptoms develop, they usually appear 2 to 7 weeks after infection. Hepatitis A is usually asymptomatic in children, and adults are prone to symptoms of hepatitis A. If they do get it, it's a 70% chance or greater that adults do get hepatitis A symptoms. So these symptoms include fever, malaise, nausea, vomiting, cramps, dark urine, and yellow eyes. Symptoms usually last less than 2 months, although some people can be ill for as long as 6 months. So as stated, this will pass and it won't be a chronic disease. So risk factors for severe acute hepatitis are older age and pre-existing liver disease. This is because people who are older have a weaker immune system and have a harder time fighting off infections. And for people who already have a liver disease, a liver infection will not help that. And then some extreme cases, you can have acute liver failure, which requires intensive medical care and usually the urgent decision on a liver transplantation. So usually if you have acute liver failure, then you're going to need a new liver. But that's pretty rare. It's less than 1% that if you get hepatitis A, that you will have that failure. Thank you for watching.